Centration of the intraocular lens is important to maximize visual acuity and to decrease ocular aberrations. This has become even more important with the advent of aspheric optic intraocular lenses such as the Tecnis 9003Z. In addition, multifocal lenses also require excellent centration. Decentrations up to 0.4 mm are well tolerated, but sometimes due to capsular bag asymmetry, decentration is unavoidable. A prototype instrument was developed to aid in recentering a three-piece intraocular lens. This instrument, called a haptic adjuster, can be used when the IOL cannot be centered on the visual axis using simple rotation. The haptic adjuster incorporates a central sliding shaft with a hook. This hook closes against a curved plate such that a PMMA haptic of an IOL would be gently pinched and bent. Depending upon where the haptic is compressed, the resulting bend causes an increase or decrease in the radius of curvature, causing the overall length of the haptic to be longer or shorter, respectively. Here, a 12.5 mm IOL is adjusted with the haptic adjuster. The change in length is from 0.5 to 1 mm, depending upon the location and magnitude of the bend in the haptic material. This produces an asymmetric compression force within the capsular bag which can recenter the IOL. Note that the sample IOL haptic, when compressed with the hook on the outside curvature of the haptic, becomes 1/2 mm longer. When the hook is placed on the inner curvature of the haptic, it is 1/2 mm shorter. Possibly it would be better to make the IOL longer in normal or myopic eyes and shorter in hyperopic eyes. In this case, the second Purkinje image on the IOL surface indicated that the lens was not centered on the visual axis. Rotation of the IOL did not provide adequate centration. Viscoelastic is instilled into the anterior chamber, and a haptic is dialed out of the capsular bag. The haptic adjuster is inserted into the chamber, and the lens is stabilized with a Lester hook. The haptic is then gently compressed with the haptic adjuster. The lens is then dialed into the capsular bag and centration is performed. The maneuver can be repeated if needed. In conclusion, using an instrument such as the haptic adjuster may help reduce decentrations in three-piece intraocular lenses caused by asymmetry of the capsular bag.